Hello everybody, it's Coffee Mud here. This video is about ectopic pregnancy. We will study symptoms, causes, and preventions. Pregnancy begins with a fertilized egg. Normally, the fertilized egg attaches to the lining of the uterus. An ectopic pregnancy occurs when a fertilized egg implants and grows outside the main cavity of the uterus. An ectopic pregnancy most often occurs in a fallopian tube, which carries eggs from the ovaries to the uterus. This type of ectopic pregnancy is called a tubular pregnancy. Sometimes, an ectopic pregnancy occurs in other areas of the body, such as ovary, abdominal cavity, or the lower parts of the uterus, which is cervix, which connects to the vagina. An ectopic pregnancy can't proceed normally. The fertilized egg can't survive, and the growing tissue may cause life-threatening bleeding if left untreated. So, what is the symptoms of ectopic pregnancy? You may not notice any symptoms at first. However, some women who have an ectopic pregnancy have the usual early signs or symptoms of pregnancy: a missed period, breast tenderness, and nausea. If you take a pregnancy test, the result will be positive. Still, an ectopic pregnancy can't continue as normal. As the fertilized egg grows in the improper place, signs and symptoms become more noticeable. Early warning of ectopic pregnancy. Often, the first warning signs of an ectopic pregnancy are light vaginal bleeding and pelvic pain. If blood leaks from the fallopian tube, you may feel shoulder pain or an urge to have a bowel movement. Your specific symptoms depends on where the blood collects and which nerves are irritated. Emergency symptoms. If the fertilized egg continues to grow in the fallopian tube, it can cause the tube to rupture. Heavy bleeding inside the abdomen is likely. Symptoms of this life-threatening event include extreme lightheadedness, fainting, and shock. So the question is when to see a doctor. Seek emergency medical help if you have any signs or symptoms of an ectopic pregnancy, including severe abdominal or pelvic pain, accompanied by vaginal bleeding, extreme lightheadedness or fainting, and shoulder pain. Here we will study the causes of ectopic pregnancy. A tubal pregnancy, which is the most common type of ectopic pregnancy, happens when a fertilized egg gets stuck on its way to the uterus, often because the fallopian tube is damaged by inflammation or is misshapen. Hormonal imbalances or abnormal developments of the fertilized egg also might play a role. The risk factors of ectopic pregnancy, some things that make you more likely to have an ectopic pregnancy. Number 1. Previous ectopic pregnancy. If you have had this type of pregnancy before, you are more likely to have another. Here you can see the chance of ectopic pregnancy in the first and second time. Number 2. Inflammation or infection. Sexually transmitted infections such as gonorrhea or chlamydia can cause inflammation in the tubes and other nearby organs and increase your risk of an ectopic pregnancy. Number 3. Fertility treatments. Some research suggests that women who have in vitro fertilization or similar treatments are more likely to have an ectopic pregnancy. Infertility itself may also raise your risk. Number 4. Tubal surgery. Surgery to correct a closed or damaged fallopian tube can increase the risk of an ectopic pregnancy. Number 5. Choice of birth control. The chance of getting pregnant while using an intrauterine device is rare. However, if you do get pregnant with an intrauterine device in place, it's more likely to be ectopic. Tubal ligation, a permanent method of birth control commonly known as having your tubes tied, also raises your risk if you become pregnant after this procedure. Number 6. Smoking. Cigarette smoking just before you get pregnant can increase the risk of an ectopic pregnancy. The more you smoke, the greater the risk. Finally, what is the preventions of this disorder? There is no way to prevent an ectopic pregnancy, but here are some ways to decrease your risk. Limiting the number of sexual partners and using a condom during sex help to prevent sexually transmitted infections and may reduce the risk of pelvic inflammatory disease. Don't smoke. If you do, quit before you try to get pregnant. I hope you enjoyed this video. Thanks for watching.